Hi. There are many reasons because I'm very happy today, because it's important for the European chapter of the Academy for Eating Disorder to work with F.E.A.S.T, the greatest, the larger association of the volunteer in the world. It's a project for us to develop our alliance with volunteers with careers. They are members of the treatment team, and we have to work with them, to educate them, to engage them, to discuss the case with them. And I can use this word, use them also, as in today. Use them because they know better than us what happened inside the wall of the house, what happened in the rituals of the dinner, especially in this period of the holidays, Christmas, where there are many occasions where people affected by eating disorders have to be with the other, and they have to stay there because there are the holidays, the larger family, and there's the food, and so there's the cue that as the kickoff to start eating. Yes. To understand more is present with us Judy Krasna. I'm very happy because she is Executive Director of the F.E.A.S.T, the Family Empowered and Supported Treatment for Eating Disorders. She's a writer. She's an advocate because advocacy is his job, but she's a long experience, and it's important to understand that she's expert by experience. Is a specific division inside the academy, because there aren't only the colleagues, the nutritionists, the dietitians, psychologists, psychiatrists, there are also the expert by experience. They are professionals because they can work concretely, daily with our patients. And so thank Judy Krasna. She lived in Israel, but she works everywhere practically in the world. And we learn today by Judy because she has a great experience concretely, and so she offered to us some tips for supporting patient and family during this period of holidays. Thanks, Judy.
Thank you very much for that really nice introduction. And thank you very much for inviting me to be here with you today. Umberto, we're speaking about the Experts by Experience Committee of the Academy for Eating Disorders. It's actually a committee that I was instrumental in getting off the ground a long time ago. I think it was in about 2015. And it's very near and dear to my heart. And I was actually very encouraged by what Umberto said, because parents are not always accepted as partners in treatment. And that attitude of accepting us and allowing us to be in treatment with you really only helps our children. So thank you very much for the introduction. And again, thank you for letting me be here today. And I'd like to get started. So what I'd like to talk about today is tips for supporting your patients and families during the holidays. My presentation is really going to be taking this from the lived experience perspective of a parent. And I think that I do have some insight that can help you to deal with your patients. I do want to talk a little bit about F.E.A.S.T. I am the Executive Director of F.E.A.S.T. For those of you who don't know about F.E.A.S.T, I will just give you a very 1-minute brief explanation of what we do. We are the only global organization that helps parents of people with eating disorders. Our community is made of people that are parents of people with eating disorders. It's parents helping parents. At F.E.A.S.T, we offer support services really around the clock, 365 days a year. We also offer educational services, and we truly believe that by educating and by supporting parents, we empower them to be able to better take care of their children. And now onto the topic. So let's start at the very beginning, right? When we're talking about the holiday season, we need to start way before the holidays start. And we need to talk about the need to manage expectations. And the truth is that the holidays are a very, very difficult time for people with eating disorders. And it's a very difficult time for their families as well. When someone in the family has an eating disorder, often instead of looking forward to the holiday season, parents dread the holiday season because it's full of uncertainty. You know that the holiday isn't going to look like it did before your child got sick. You don't know what to expect. And it's actually very panicky. So what makes the holidays fun for so many people makes it terrifying for someone with an eating disorder. And it's very important when you set your expectations and when you plan your holiday, we tell parents that it's very important to make sure that some of the activities, some of the festivities don't include food, don't include large groups. They really speak to the person with the eating disorder and their interests and things that they've always loved about the holiday. And I think as a parent, I can say that what's especially difficult during the season is if you have more than one child, then you have to balance the needs of your entire family. It's not just that one child with the eating disorder. That one child with the eating disorder is obviously and always a priority, but you also have other children and other extended family, and parents have to balance everyone's needs to make sure that everyone has a good holiday, and it's exhausting. So when you're looking at the families who you're treating, just take into account, it's a really, really difficult season for everyone. And I think it's really important to let parents know that this holiday may be different. It doesn't mean that it's less than it ever was before. People can make new traditions. They can really start new customs. They can celebrate the holiday differently than they did in the past. And it's not the same. And there is a feeling of loss, but it doesn't have to be a bad holiday just because your child has an eating disorder. Now, I personally would suggest that you start this whole process of setting expectations with a conversation. And the conversation obviously has to talk about what would make the holidays easier for the person affected by an eating disorder. And ideally, this conversation should take place with the provider and the parent and the person affected by the eating disorder, because it's really important that everyone is on the same page, that everyone shares the same expectations. And, you know, the next question is who or what are the major stressors? In my experience, there are several stressors during the holiday season. Obviously, the big one that Umberto talked about is holidays mean food, 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 and more food. No matter what religion you are, no matter what culture you come from, holidays, generally speaking, involve food. So there's that. There's also socialization. Eating disorders are isolating. A lot of people with eating disorders, they don't socialize the way that they used to. They don't like big groups of people. So a lot of times the holidays are filled with large groups of people, and that can be extremely uncomfortable for someone with an eating disorder. They may feel that people are looking at them. They may feel that people are judging them. Even if they're not, that may be the way that they feel. So it makes it very uncomfortable. And also, unstructured time and a lack of a schedule can be very, very, very offsetting for someone with an eating disorder. That, lack of regular meal times, lack of regular, this is when I go to school, not knowing what to do with their time or how to fill their time, that can be a very big stressor. So it's important to set expectations in advance and to talk about compromises. I think it's important to understand that, someone with an eating disorder isn't necessarily going to agree on a reasonable expectation, the same as they don't view it the same as their parents would view it. So I think it's important to set a stage for what are all the expectations, and then discuss, okay, what's reasonable, what's not reasonable. Someone with an eating disorder is not going to be flexible, and parents have to understand this, that you can't expect a person with an eating disorder to just agree to whatever you're going to propose as a family. So you have to start with this conversation. Talk about what would make it easier. Talk about what's non-negotiable. Talk about what compromises you can reach. And the expectations in this conversation will be very different based on what stage of recovery a person is at. Somebody at the beginning stage of an eating disorder, is going to have very different expectations than somebody at the end stages. So next slide. Sorry, Don. Okay, so when we talk about setting the expectations, what are we talking about? So we're talking about discussing participation in holiday meals and other family activities. We're expecting that at some stages of recovery, there may be fear foods incorporated into meals. And if that's the case, it's going to produce a lot of anxiety. And that leads to resistance. You have to expect resistance in meeting these expectations. And you have to also make sure that both parents are on the same page for setting and enforcing expectations. And this is really where providers come in. And this is really where parents need you. It is so common for parents not to be on the same page. It is so common for one parent to really understand what the child needs, and the other one feels bad. And I understand, right? You're seeing your child's distress. Tolerating it, especially during the holiday season when there's so much going on, is extremely difficult. But it's really important that both parents decide what are the boundaries, right? And also sometimes these boundaries move, they're dynamic, they're fluid, and sometimes they aren't. And parents really have to have these conversations in advance of the holiday of, what are the expectations? How do we enforce them? What do we allow for in terms of, being a little bit less rigid and a little bit more flexible? But these are really conversations that have to happen way in advance of the holidays. And another consideration is, how do you manage the environment for the person with the eating disorder? A lot of times parents underestimate the eating disorder. They don't think it's going to be a big deal to travel, right? I've always gone to Paris for Christmas. I've always gone to Israel for Hanukkah, and they're kind of like, well, this is what we always do. We're going to get on the plane and we're going to go. And they really don't understand that this may not be the year for travel. This may not be the year where your child is actually able to do this. So you have to really consider before making travel plans, is this a good idea? And also, it may be a good year to host and not to be hosted. I know traditions are called traditions for a reason, and people are very attached to their traditions. However, there are times, like when your child has an eating disorder, that you have to make new traditions, and you have to consider whether the traditions you've always had are safe and comfortable for your child. So, sometimes people with an eating disorder are much more comfortable eating at home than they would be eating at someone else's house. If that's the case, then invite everybody to your house. Is it a lot more work? Yes. Is it really hard because you're managing a child with an eating disorder? Yes. But at the end of the day, sometimes it's just what parents have to do. If parents are being hosted, I would tell them to make sure that their child has the food that they're going to be comfortable with, at the meal. So you can offer to bring something that your child will eat. It's also important to prepare or to educate guests, either at your home or wherever you're going, in advance. Now, I know that there are some people with eating disorders that don't want this, meaning they don't want you to tell the host or to tell your guests, my son has an eating disorder. These are some things that you probably shouldn't say or shouldn't do. But at the end of the day, people really need to be prepared. People really need to know the situation. It will really make it so much easier for everyone involved and much less awkward at the end. The next way to manage the environment is a really, really hard one, which is to keep the environment clear of toxic people. I'm going to get into that in more detail later. But every family has people who shouldn't be around someone with an eating disorder. And it's really important to take that into consideration. And also, if the person with the eating disorder is having a really hard time at the table, just move them to a different room. So there are definitely ways to manage the environment that make it more comfortable for someone with an eating disorder. Now, it's interesting because paradoxically, for me personally, my daughter always did so much better when we would eat somewhere else. When we were on vacation and we were in a hotel or we went to a restaurant, my rule was I brought a lot of food, right? I was very flexible in terms of letting her eat what she was comfortable with, but there were certain times when she just had to eat what we all ate. And she did. And so I actually found vacation to be an actually good time in terms of, kind of helping her with eating disorder recovery. But a lot of people find that to be the exact opposite. If you take the person out of a comfortable environment, they really, really, really have such tremendous anxiety that it can set them back in their recovery. So each person has to evaluate for themselves as to whether it's good for their family or bad for their family. And parents also have to really understand that making the environment safe for someone with an eating disorder can be very awkward, because you're going to have to speak to people who you know and love about certain behaviors, and have very honest conversations with them. And the last point on this slide in terms of managing the environment is it's very important to make sure that the eating schedule is consistent. You can't have meals all over the place. So parents have to know it doesn't matter if you're traveling, it doesn't matter if you're on vacation, it doesn't matter if you're at grandma's house. Your meal schedule is your meal schedule, and that has to stand. So that can't be flexible, that can't be changed. And parents really have to take that into account if they do plan a vacation, that meals have to be consistent. So when I talk about no toxic people allowed, it can mean grandma and grandpa. And this is really where it gets difficult for parents to manage, okay? Because we don't want people around their children that are going to talk about diets or calories or overeating or the food on anyone's plate or anyone's body or a sense of fullness or the need to exercise to compensate for eating. Now, you put 10 people in a room, okay, in any country in the entire world, and see if you can get 10 people sitting around a table with food who are not going to talk about any of these things for the course of 10 minutes. I don't think you can, quite honestly. It's just impossible to gather a group of people without hearing about all these things. And these things are triggers for people with eating disorders. So people who are traditionally included in holiday meals and other festivities may not be safe for someone with an eating disorder. And parents have to think long and hard about if they're going to spend the holidays with people who may not be safe for their child. And everyone has relatives who make comments like, oh, I don't eat carbs, or wow, that's a lot of calories, or I'm so stuffed, I'll need to work this off in the morning, or hey, it's cheat day, I can eat whatever I want, or you look great, have you lost weight? And these are all things that can really, really hurt someone with an eating disorder. I know I'm not telling you anything you don't already know. I know you do this day in and day out, but I just want to say that, from a parent perspective, it's really hard, okay? Because parents have to understand that you have to remove the toxic people. And it's a really hard thing to do when the toxic person is your mother or your father or your aunt, and you have to explain to them why they can't come to your house this year. And it makes for very delicate conversations and hurt feelings. And it's something that parents, naturally, you don't want to do it, meaning nobody wants to get in that situation. But sometimes parents have to be involved, but they have to. For the safety of their child, they have to have these conversations. Okay, next, sorry, Dawn, next slide. So this is what is so difficult. And if you take anything away from this presentation, please take this away. It is so hard to balance the entire family during the holiday season. It's impossible, okay? Parents are expected to do the impossible. So we need to make sure that the impact on siblings is minimized to whatever degree possible. And we need to minimize feelings of hostility and resentment. So I just talked about toxic people and the fact that you may have to tell your parents that they can't come to your house for the holidays because they may trigger your child. There's also the feelings of hostility and resentment if every year you go to Italy for the holidays, and this year you have to explain to your children that because their sibling is sick, you can't go. There is hostility, there is resentment. Parents can have resentment. Because, the feeling of, I don't get my vacation. How come I don't get normalcy? Why do I have to be stuck at home with a sick kid? There is just a lot of negativity going around, and parents have to do whatever they can to minimize those feelings in themselves and in their other children and in their extended family. And so my suggestion really is, in balancing the entire family, sometimes parents can opt to split between the affected person and the sibling. You know, if somebody is in the very early stages of recovery, or they're in the hospital and they need someone to be with them, or they're just not in a place where they can go out and be with people. Sometimes, you know, parents don't want to ruin the holidays for the entire families. So mom can go with the kids and dad can stay with the person with the eating disorder, or they can switch, or they can switch in the middle, or sometimes they can make a decision that they'll eat, the person with the eating disorder will eat at home and then join the rest of the family for festivities after the meal. There are a lot of different ways that this can be done. It feels really awful, actually, to split your family for the holidays. I know that the first summer that my daughter was sick, my husband and I really gave a lot of thought as to what we were going to do, because it was an entire summer vacation with the child in the hospital, and we didn't want our other kids to be stuck at home doing nothing for a whole summer. So what we decided to do, as Umberta said, I live in Israel. We have a lot of relatives in the US. So I took my 3 kids to the US for 4 weeks in the beginning of the summer. My husband and I literally kind of met each other in the air. I went home to be with my daughter in the hospital, and he went to be with my other 3 kids. We were separated for 2 months. It was really, really hard. It was really hard at a time when we needed each other for support, not to be with each other. But it was the best thing for our family, because it gave my daughter in the hospital the attention, the full attention of one parent, and it gave my other kids the full attention of the other parent. And sometimes you have to do things that are really hard just for the benefit of the whole family. You can also ask family members to take siblings out for outings or to do activities, just so that they don't feel like they're stuck at home. Again, you want to minimize those feelings of resentment and hostility. I believe in a 2-car approach for holiday meals or any other festivities, if you have that luxury, you know, and you want to have an escape plan, right? You're taking this child with the eating disorder with you, you're going to someone's house, you're not sure how they're going to react, how comfortable they're going to be. Take 2 cars so that if their anxiety gets ramped up, and if you need to take them home, you don't have to ruin the holiday for everyone in the family. Some people can stay and you can take your child home. So those are some ideas of how I would suggest balancing the entire family. But I can honestly say that this is the most difficult piece for parents. And the other difficult piece, really, from a personal perspective, is not projecting any guilt or negativity. You know, it's so hard to be very factual about it. You know, your sister is sick, your brother is sick. That means the holidays are going to be different this year. Very factual. You know, there's no emotion in it. There's no negativity in it. It's just a factual thing. You know, your sibling has an illness. We're doing the holidays differently this year. And it's something that's really hard because it is an emotional time. And because we all really have these fond feelings for holiday traditions that we may miss, but really it's important to make the best of it for the whole family. So I found that something that's really helpful for me personally, in regards to keeping it positive and really to helping my own child, was to take a trip down memory lane. We went through old photo albums, old videos, you know, looked at pictures from holidays past, looked at videos, to try to capture some of what was, to try to remind the affected person of what their favorite holiday experiences were, and to try to connect the holiday with positive memories. And that's something that, again, it's kind of hard because, you know, it makes you feel even worse sometimes about what you're missing, about what used to be. But it's a really good way to connect a person with an eating disorder with who they were, and with really positive associations with the holiday. And also just, I think when you look at these old photos and videos as a parent, it reminds you what you're fighting for. You know, you see the happiness in your child's eyes, you see the joy that they had during the holidays, and you so want to get that back. So I feel like when you open these photo albums and you start looking at family videos, it gives parents a lot of motivation to fight another day, to fight really hard, to, you know, gather their strength, even when it's really depleted, and, you know, to try to associate the good part of the holidays with this child who has an eating disorder. I also have a suggestion of creating new holiday traditions that don't include food. So many holiday traditions do include food. And also so many holiday traditions have an association with the past, which is not a bad thing necessarily, but sometimes it's really important to just do something new. So some of the things that I would suggest, that you could recommend to families of people that you treat is, a family scavenger hunt or a movie marathon or like a quiz game or like an outdoor activity that's not strenuous. Just sometimes when you get in a different place, in a different mindset, you're able to shift things a little bit. So that's one of my suggestions, is to create new holiday traditions. As I mentioned, it's really important to keep structured meal times, to maintain a regular meal and snack schedule, to take snacks and meals when you go out on outings, and to build meal and snack time into planning activities and daily schedules. As I said, it's not reasonable to expect someone with an eating disorder to be flexible. It's really important to keep things as same as possible. And I also want to talk about that a little bit in terms of the food, because it really depends on where in recovery your child is. Some parents want to take the opportunity of, favorite foods from before the eating disorder to reintroduce those foods. And they want to challenge your child's eating disorder to eat these foods because that they really do love them. And other times, you want to keep it safe and sane, right? You don't want to mix it up. You don't want to, the holidays are disturbing enough for someone with an eating disorder. So, parents sometimes are torn between what to do. They're torn between, do we challenge our child with fear foods, or do we keep it, the same, structured meal plan without any changes? And that's the place where you advise them, obviously, as to, what's best for this person with the eating disorder. Holiday clothing is something that, I don't know that is something that you necessarily think of. It's something as parents that we do think of, because a lot of times for the holidays, people need new clothing because their clothing doesn't fit. And clothing shopping, my daughter loved to shop for clothes. And even when she had an active eating disorder, she would still shop with like glee. And even when the sizes got a little bit bigger, it didn't affect her that much. But I know that there are parents out there who say that as soon as they have to buy that new pair of jeans or go up a size in clothing, it provokes huge anxiety. So parents need to anticipate the need to buy holiday clothes. I suggest shopping online when possible, because then there's no trying on clothes. There's something about the whole experience of a dressing room and trying on clothes and looking in a mirror that's very difficult for people with eating disorders. So when you shop online, you really do get rid of some of that. I think it's important to expect that larger sizes may trigger body negativity and resistance to eating. And it's important that parents are prepared for that. Parents, a lot of times, when we ask parents at Feast, what is the number one thing we want to help, you need our help with? They'll say, we don't know how to speak to our children. A lot of times people with eating disorders, their parents feel like they're walking on eggshells. You don't know what the right thing is to say. So you don't want to say anything because you're afraid to say the wrong thing. And this is one of those situations where, your child is going to say something like, oh my God, my body is so big, I can't do this anymore. And as a parent, you need to know what to say. So it's very important to prepare the families of people with eating disorders so that they can correctly, if there is a correct answer, or at least competently, speak to their children about this larger body size and, kind of increase in size. My other suggestion is to remove the size labels from clothing. Again, kids are not stupid. They know when you're removing the size labels, but sometimes they don't mind because it really is so traumatic for people to see that their sizing went up and they just rather not see it. So I do recommend remove the size labels when you can, because it does help to alleviate some of the anxiety over the holiday clothing. Monitoring anxiety levels. This is really hard. I'm not only talking about the anxiety levels of people with eating disorders, I'm talking about the anxiety levels of parents as well. This is a really, really stressful time. And as much as people may have loved the holiday before their child got sick, they hate it even more now that their child is sick. And it causes them tremendous stress. This whole balancing thing that I talked about between making sure that everyone in the family has what they need and everyone in the family is happy, it takes a huge toll on parents. So it's important to recognize that holidays provoke anxiety in people with eating disorders. And it's not just the food. As I mentioned, it could be the lack of regular schedule. It can be extra people in the house, and that even includes siblings home from college. You know, we think, oh, it's just their sister, they won't care. But the bottom line is they do care. Having an extra person at the table, having an extra person in the kitchen all the time, having an extra person sometimes in your room, it makes a big difference. So, you know, it's just important to take into account that these changes in, you know, the situation in the house, even when it's a person's sibling, and even more so when it's a grandparent or an aunt or an uncle or cousins or other family members who kind of, you know, transcend upon your house and are everywhere. So that's something to take into account. There's expectations of social interaction, you know, things that we would have never thought about before. Like, of course, coming in the kitchen and saying hi to grandma and grandpa, you know, someone with an eating disorder doesn't necessarily want to be social. It can take a lot of their mental energy to be social, and they don't have mental energy. And everything they have is going toward, you know, eating and focusing on their recovery. So it's very important to really check in with your person often. You don't have to necessarily do it with words, although you certainly can do it with words. But it's important just to monitor a person with an eating disorder extra carefully during the holiday season to make sure they're okay. If they're not okay, you know, again, sometimes people need more treatment appointments during these holiday seasons. It's not always viable, but when it is, you know, sometimes providers have to be really extra involved during the season just to make sure that everyone gets through it okay. And the most important thing for parents is practice self-care. And I laugh when I say that because parents don't have time to practice self-care, but it doesn't make it not important. It makes it vitally important. So every parent out there has to find what self-care is to them. You know, I laugh when I hear self-care because I think of it as bubble baths and candles and all these things that, you know, I would never have time for, not in that life and certainly not in this life. But, you know, it's not always that. It could be take 15 minutes to read a book. It could be watch a show on Netflix. It could be take a walk. It could be anything that gives you a little bit of a sigh of relief, the ability to just breathe a little bit and lower your anxiety level. So it's really important to make sure that everyone in the family practices self-care to whatever degree that they can. So I'd like to just conclude by asking what can help people with eating disorders and their families get through the holidays. So just an overview of the points that I discussed. Preparing the ground in advance is really important. Setting and managing expectations, creating the safest possible environment, which is really, really hard to do. And again, parents sometimes have to be told to do this. It's not necessarily intuitive. So parents have to really understand the importance of a safe environment for their child. Strategies for managing anxiety, compassion, patience, and support. And that's really hard. It's really hard to be compassionate sometimes as a parent. I admit, you know, you have to work really hard at it sometimes. But it's really, really important. And it's really important that support component is really important. And that's really, I think, part of where F.E.A.S.T comes in here is that, you know, when you go to our forums around this time of year, it's inundated with posts about holidays. You know, parents have questions. You know, what do I do in this situation? What do I do in that situation? Should we go away? Should we stay home? Should I challenge my child's eating disorder? And a lot of times parents are able to answer other parents by saying, you know what, 2 years ago, I was in the exact same situation, and this is what we did, and it really helped. So support is really, really important. Peer support is really important, and certainly provider support is really important. You all play such a critical role in helping these families. And I know, as a parent, I certainly would appreciate that. So I just wanted to ask, we rely on referrals to reach parents and caregivers. F.E.A.S.T currently serves about 7,000 families in over 33 countries around the world. 7,000 is nothing compared to the amount of families that we need to reach. And the only way that we're able to reach more families is through providers. So we really ask that providers recommend F.E.A.S.T, refer families to F.E.A.S T. Just tell families who you treat about F.E.A.S T so they can come to our website, so they can benefit from our free services, and most importantly, so they can be supported by our community. Because it really is, it's amazing to me that there are 7,000 parents from all over the world, from totally different backgrounds and cultures, but somehow that common bond of having a child with an eating disorder forms this amazing community. And when people, talk about it afterwards, what helped you the most, it was that community aspect. And I really liken F.E.A.S.T to, you're climbing up a mountain and it's really, really, really hard. And you get to the top and you're successful. And what do you want to do? You want to go down the other side, right? But the parents of F.E.A.S.T don't go down the other side. They turn around and they reach out their hand and they pull other parents up. And that really is what F.E.A.S.T is. And we're here for parents all over the world. They just need to know about us. So if you'll help us and just get the word out about F.E.A.S.T, I would really, truly appreciate that. So thank you so much for listening. I really appreciate your attention. I wish a happy holiday to everyone and their families. And are there any questions?
I hope that there are some questions, because I'm very excited. Your presentation was very wonderful. You touched so many aspects, and that it's important for everybody to learn. Between the group today, there's someone, Maria Grazia Giannini. With me, we are learning by you, because Saturday morning we organize in Italy a similar webinar to spread in our language, because that there's the difficulties, there are the barriers in the world, the barriers to the language, the tradition, the culture, also to spread this kind of attitude in Italy too. I hope that in every country it arrives this message. Period of holidays period, Christmas period, is very full of micro trauma, of the risk of micro trauma. And so you have to understand how to manage them. It's very important to understand well. And Maria Grazia Giannini, if she wants to pose some question, but from everybody, me, I'm very interested to understand some specific vignette. When I follow the course by World Health Organization, after the explanation of the topic, they use normally to present 2-3 vignettes concretely, where there are the discussion between the people. And so you put, for example, how to maintain clean the environment by the toxic people. Okay, some vignettes to explain how you can manage it.
So are there some comments or questions that anyone would like to share?
I actually just want to comment on what Umberto said before anybody, and I really do hope that you do have questions. But I just want to comment, it was interesting because F.E.A.S.T had a webinar yesterday on a topic similar to this. And one of the people who attended was someone who had recovered from an eating disorder. And she said that sometimes, these triggers are not necessarily a bad thing, because if you learn how to manage them, then sometimes it can actually be a positive experience. So she said, it's important to talk about after, which I didn't mention in my talk, but if something happens, right, we try to make the environment as safe as we can for our children. But sometimes we fail because we're human. And even though we may have told our relatives a specific list of what not to say, they might not have listened. And our child sat at the table and heard comments that may trigger them. But it's important to talk about it afterwards, to, kind of see, how did you feel when, Aunt whatever said this comment, and to kind of also bring it to the providers to make sure, that they handle the situation okay. So it's not just the laying the groundwork before. Sometimes it's also discussing it afterwards, and kind of seeing how they are, how that sat with them. And sometimes it doesn't always have to be negative, these experiences. Obviously, as parents, we want to prevent them, but if they happen, it's important to do damage control afterwards, and to make sure, that they aren't hurt by these things.
Judy, Irene Best put a comment in the chat box, and she said, I like what you said about non-food related traditions. For the past 2 Christmases, we have joined grandparents to see a play or a light show.
And that's a really great idea. And that's, what I found personally is when you can kind of move some of the traditions away from food and away from loud, large groups, and make it something more personal and more meaningful. It doesn't make it less than. That's what's really important. Parents think, oh, this is going to be a terrible holiday. No, you can't have that attitude of it's going to be a terrible holiday. You have to acknowledge that it's going to be a different holiday. But different doesn't have to be less than, and different doesn't have to be horrible. And yes, you have a sick child, and that's a terrible thing. But you can still make something of the holidays if you try.
Somebody put in the chat again, the comment, we skip the Nutcracker for sure. We Christmas carol instead. Is the Nutcracker a triggering experience?
You're asking someone who didn't see it, so I'm guessing that whoever posted it thought that it is.
It's Ebba Meehan. Ebba?
Okay, so she said yes. Yes, it is. And that's also a consideration, obviously, is, everything's a consideration, basically. You have to think through absolutely everything that you do, everything you expose your child to. It's really hard. And yes, ballerinas often do have eating disorders. I don't know that I would necessarily avoid the ballet altogether. It also depends on the person and the stage of their, recovery and how it affects them. But yes, definitely, as a parent, you have to think through everything. So that's definitely an interesting consideration. In answer to the question of what's the most important thing providers can take from this webinar, I found that when my daughter was being treated, no one took into consideration that I had other children. The expectation was that my husband and I would take 100% of our resources and put it into this one child, which I understand as providers that that's the ideal world. But we don't live in an ideal world, and people have other children, and people have families, and some people have to care for elderly parents. It's complicated and it's messy. And I think it's really important for providers to just understand the reality of parents is that even though we would love to dedicate all of our resources to this one child, you have to help us find that balance. You have to help us prioritize. You have to also validate the fact that we're doing the best that we can in a really awful situation. It was in my bio, but I'm honest about the fact that I lost my daughter to an eating disorder. So I understand the toll that an eating disorder can take on an entire family, in the worst case scenario. And, it's so important for providers to support parents and to support families and to just work with us and to include us as part of the treatment team. That really is just so important, because I think we can add so much to treatment. We know our children so well, right? Providers know eating disorders. They're the experts on eating disorders, but we as parents are experts on our own children. And we can contribute a lot to treatment because we have that insight about our child. So, I think the most important message is just take into account it's hard for a person with an eating disorder. I would never want to minimize that, but it's also very hard for parents and for families. And let's just see the whole picture of that.
Helen has asked a question. How would you approach potatoes? As in, we always had roast potatoes at Christmas and my daughter wouldn't eat them. What should I do?
And that is a really personal decision. There's no one answer to that, it's so variable. There are some parents who, are very aggressive about exposing their children to foods that they know that they like, but they won't eat because they have an eating disorder. And there are other parents who are very conservative and who say, you know what, let's everything in due time. So there are different approaches in treatment also, obviously. There are some, dietitians who offer meal plans and you don't deviate from the meal plan. And there's other dietitians who say, okay, kind of flow with what's being served. So I feel like there's no one answer to that. Every parent has to evaluate when to push, how much to push, and also, where the boundaries are. Meaning if part of your expectation, and that's where the expectations come in, that would be an expectation, right? Before the holiday meal ever started, before any of the food was cooked, this would be a conversation, okay? The expectation is that you're going to eat X, Y, and Z. And again, it's a conversation that includes providers. It's a conversation that includes an entire treatment team, meaning we want to make sure the expectations are realistic. No one wants to damage their child, right? You don't want to push too far. You don't want to do the wrong thing. So this is a broad conversation between a lot of different people to figure out what's best for each person. But I think every family has those type of considerations of, do I not serve X? My answer would be no, absolutely serve it. Meaning don't deprive everyone else of a holiday tradition just because one child won't eat it. As to whether or not to get this child to eat it, that's not something that I'm qualified at all to answer, nor would I even want to, because I think it's really so individual. The question about siblings is really hard. I don't know how, quite honestly, I don't know how providers can really help parents help the other siblings. I don't know that it's necessarily their job. I think providers need to put their full energy into the sick child. I just think that they need to take into consideration the fact that there are other people in the family and to support the parents the best that they possibly can. For siblings, it's really hard. I mean, F.E.A.S.T, we are actually starting a sibling support group along with this organization, ANAD, in the US. It's really pretty revolutionary. I don't know that there is a sibling support group, out there that's professionally run. And I'm actually really looking forward to it because I think siblings really, really need support. And it's not out there. So the opportunity for siblings to speak together, speak to each other in a moderated forum, and to be able to unburden themselves and to hear about other, to gain that support. It's that peer support that really is the basis of F.E.A.S.T that we'd like to extend to siblings. So we'll be starting that in February, and I really hope it's successful because siblings really, really suffer. And it's something as a parent, it's so hard because you see it happening, right? You see it happening, your other kids are suffering, but you can't divide yourself into a million pieces. The priority, generally speaking, is the sick child for a while at least, and that's just the way that it is. So as parents, we do our best. I think providers can really help parents just by validating that we're doing our best. And, you can't do anything more than that. So, I agree that it's really, really hard. The challenge of having a sibling with an eating disorder is a very, very real challenge. And I think it's important to give siblings some type of space to actually get support by others who really understand them.
Judy, not just siblings, but as a grandparent and a great-grandparent, I've been blessed by having a very close family and the Christmas season for us is a very important family. And when I was listening to you say, sometimes you just have to tell your grandparents that they can't be involved, I would be heartbroken. I would have, because I would want to be informed and included. And if there was something I was saying that was triggering, I would want you as the parent or the parent of my grandchildren or my great-grandchildren to tell me so that I could behave better. But I would be psychologically heartbroken if I was excluded from those events. Any thoughts on that?
Look, as a grandparent myself, I can say that I'm very careful around my grandchildren. I'm very careful around my children. I try really hard. Grandparents have a special place in this relationship, and it's important to respect that. So I totally hear you. I think there are a lot of grandparents that accept the conversation and certainly would want to know. I mean, look, at F.E.A.S.T, it's not just parents. We basically provide peer support to caregivers. A lot of times the caregivers are the grandparents. You know, the grandparents want to learn. They do our Feast 30 Days program. They go on our website. They read resources, meaning they want to be involved, and they can. Grandparents can be amazing supports, but sometimes they need to understand that some of the things that they say and do can hurt a person with an eating disorder. And I agree with you. I would hope that they would accept it in the way that it's given, meaning it's given because you want to protect your loved one. It's given because you love the person and you want to keep them safe. So I would hope that it would be accepted like that, but it is a really difficult conversation. And it's important to acknowledge that parents have this really big burden when they have to have these conversations, because, you know, they're carrying the burden of a sick child, and they're also carrying the burden of not wanting to hurt somebody who you love. So, and you know, this conversation is going to be hurtful, no matter how polite, no matter how loving, no matter what tone you take, it's going to hurt. So just the acknowledgement that parents have to have these conversations and that they're difficult.
Irene Best has another provocative comment. Irene, would you like to share your comment in the chat room?
There are also Helene here that work inside the European chapter board. That is our representative in Europe for F.E.A.S.T, if she wants to say something. I love very much this webinar today. I haven't transferred directly to the question posed by Dawn, but I think that is important also for me, because I'm since more or less 50 years that I'm provider. And I love this webinar because I understand more what happened in the daily life for the people. Me, in my office, I can say to the parents, you have to be more attentive to the trigger that start the sufferance. And so you have to imagine that along this period of holidays, there are many conditions where there are microaggression, and so you can underline, so spread more stigma. And so you have to prevent it. But concretely, as Judy said, it's impossible for me. This is real life. And so it's a school for me.
Well, I also just wanted to add, you know, part of the reason why I'm so excited to be here is because I think it's so important for F.E.A.S.T to have a strategic alliance with the European chapter. I think we share goals. I think we share the same vision. I think only together we're going to move the needle on recovery. And I think that, you know, really, we want the same things. You know, we want to improve outcomes. We want to reduce death. We want to reduce suffering. And one of the things, you know, I was told an interesting, you know, I was talking to one of our clinical advisors a few weeks ago, and she said something really interesting. She is the head of an eating disorder department at a very well-known hospital in the US. And she said, I love treating patients whose parents have been supported by F.E.A.S.T. She said, because they're easier to treat. Their parents are already educated about eating disorders. They know what to do to help. She said, I'm not starting at square one. And that to me was so validating. And this is the reason for the alliance. The reason for the alliance is because we can make it so that when you're reaching your patients, if their parents have already been through some of F.E.A.S.T services, you'll have a better outcome. These parents are already knowledgeable. They already know, you know, you're not starting with what is an eating disorder. You know, they're much easier. These kids are easier to treat. These adults are easier to treat. So, you know, that to me is a really good reason for this alliance. And also, I think it's really important to get rid of the barriers that sometimes exist. That's kind of like the us versus them mentality. I know that when my daughter was being treated at first, there was very much that mentality of, you know, you're a parent, you stay on your side, and we're the providers and we're going to stay on our side. And I don't think that it served anyone, not you, not us, and certainly not patients. So I think it's really, really important to break down those barriers. And I think that's really part of what we're doing here today is, you know, to accept experts by experience, you know, to really work together. And just one last thing, just a request is that, you know, if you're doing research, we would love to be included. One of the things that really upsets me is to see research being done without lived experience. So I just want to say, if you are a researcher out there and you're looking for lived by experience partners, please come to me at F.E.A.S.T, because we really are so interested in improving, the quality of treatment, and that can only be done through research. So I will stop now, and you can,
Well, we are stopping now on our webinar. It was very, very important. I want to advise my colleagues. You have to open the doors of the studios, the private or public studios, to the careers, because they know better than us what happened in the concrete life of our patients. And so they can help us to understand more what are the triggers that start the sufferance for our patient, and what we can do using also the capacity, the expertise by this career to prevent, to maintain more balance, to observe, as Judy said before, the balance of anxiety and so the mental states of our patients, thanks to careers. This is the reason, because for us, this webinar is important. It's important also to look in the next days in the webinar on demand in our website. I want, before to close this webinar, to thank Elisa Meyer and Dawn Gannon, because we can do what we are doing thanks to them. Thanks to everybody. I look at it. Next webinar organized by European chapter on January 19, where we'll discuss about obesity. Is a topic inside the arena of eating disorder. Okay, have a good holidays. Thanks a lot, Judy. Thanks a lot to everybody.